So I think we should get started. I think the next 45 minutes going to be very exciting for you all, probably, hopefully very inspirational because you're going to be seeing how research and the title for this next slot, next session is how research can actually inform policy change and how to be an influencer, and really two wonderful model of how this is being done. So I'd like to, like as I introduce you, both of the presenter, but also the moderator, please come up to the podium, to the high table up here. So first will be Dr. Margaret Blas. You know her very well. This is going to be her fourth presentation on this stage. So hopefully, you know, a lot of work she has done in the Amazonian Peruvian community. Again, very inspirational in how it actually have transformed policy. So welcome, Dr. Margaret Blas. Next will be Dr. Luis Carvo, who is a family physician and a clinical epidemiologist. He has been working, you know, collaboratively with the WHO as part of the scientific advising on how intervention and also evidence-informed medicine and intervention are being adopted, but also help provide the coordinated development of PAHO policies and research for health. And he's also have been served as a senior scientific editor for BMJ Clinical Evidence. Again, a lot of example from Dr. Luis Carvo. Welcome. And this session will be moderated by Dr. Nalindi Anand, who did a wonderful session yesterday. And as you know, she is the director for the Center for Global Health Sciences at Fogarty. So welcome, Dr. Anand.
Thank you, man. I'm really excited about this session. You all are in for a treat. Research to inform policy change, how to be an influencer. So the session is really going to explore how to maximize the potential of your research to affect real change and improve health. So what questions do you need to ask at what stage of your research, and of whom? Who should be consulted? Who should be engaged? What outputs will best facilitate program and policy change? These are just a few examples of the questions that our two presenters are going to discuss. So you're in for a really stimulating session. So we're going to start with Magali, please.
Well, thank you very much for the opportunity to present at this session about research to inform policy change, how to be an influencer. So it was 2008. I just finished my PhD in epidemiology at the University of Washington in Seattle, and I wanted to become an independent researcher. So I decided to apply for my Fogarty Fellowship to study a neglected infection, the human T lymphotropic virus, a virus that produces leukemia, lymphoma, and tropical spastic paraparesis. And what I wanted to see is that if similar to HIV, women with HTLV had also a high prevalence of HPV. In other words, I wanted to see the association between HPV and HTLV. Joe Sand was my mentor. I submitted my application. Fogarty gave me this beautiful and wonderful opportunity, and I sat on the same chairs as you for this orientation. We decided to conduct this study among the Shipibo-Conibo indigenous group because we suspected they had a high prevalence of HTLV. Actually, we went to 2 communities in Lima and 22 communities in Ucayali, in the Amazon region of Peru. I was excited. Actually, it was the first time I was running a project. We recruited for this study 1,253 indigenous women, and we named this project AIMBO, which means Women in Shipibo-Conibo. I hired a team of nurses. We took blood samples for HTLV and cervical swabs for HPV. We presented the results to the community, and actually I oversaw every piece of this study, from protocol design, implementation, data collection, analysis, and finally, the publication of 2 studies. And I came here to the NIH to present my findings. So I thought at this time that I was changing the world. But actually, I realized I was only changing it a little bit, because when I returned to the communities, I saw women living under the same conditions, without water, electricity, sanitation, and with a high burden of other diseases. So I started to think how useful it was for these women to know they have HTLV. They had a high burden of other diseases. If we identify a pregnant woman with HTLV and we know HTLV is transmitted through breast milk, what can we recommend her? Can we recommend her to stop breastfeeding? Because there is no formula available. And even if there was formula available, there was no running water. So even suggesting that can even be dangerous. Now, regarding women who needed treatment for the cervical lesions, some of them didn't want any treatment at all because they were afraid of not becoming mothers. And motherhood gives you a status on indigenous communities. In indigenous communities, if you are a female, you are someone if you are a mother. So I realized I never asked myself all of these questions before starting my study. So this is why I became disappointed. And this disappointment collided with the enormous gratitude that indigenous communities expressed, because before AIMBO, there was no intervention targeting indigenous communities at all. So after these events, I decided that for my next project, I will place the needs of the community above my academic needs. Because as you see, I started this project thinking, what is not known in the literature about HTLV and its association with HPV, rather than thinking, what are the needs of these communities? So I learned this vital lesson that led me to build my next project. So while working in AIMBO, I became pregnant with my first daughter and I delivered. And experiencing my maternity in the Amazon completely changed my view of the world and my research, because I was able to not only see, but feel more intensively the huge gap in access to healthcare that women and their families in Amazonian areas face. Communities in these areas had to travel hours by river to get into a healthcare facility that is usually understaffed and without basic supplies to manage emergencies. And these travels are expensive, and also it can be dangerous because they travel in these canoes that can easily flip over. So I knew I needed to do more than just observe and studying a problem. I had to design an intervention to close this gap because there was a high maternal and newborn mortality. So that is how I decided to change my line of work and now to research to improve maternal and newborn health in remote indigenous communities in the Peruvian Amazon. So I submitted a grant application to Grand Challenges Canada through the Bold Idea Initiative and to the Peruvian Council of Science and Technology. And this is how Mamás del Río, or Mothers of the River, started. So what do we do in Mamás del Río? Mamás del Río, or Mothers of the River, is a social innovation in health project that aims to improve maternal and newborn health in remote, rural, and indigenous communities in the Peruvian Amazon. We train community health workers so that they can conduct home visits to pregnant women, newborns, and their families, teaching them the best practices around pregnancy, delivery, and the care of the newborn. And the innovative aspect of our program is that these community health workers go with tablets that have a health application that displays educational content in the form of pictures and videos that were created through a process of photo voice and storytelling, thanks to the wonderful work of a former Fogarty Fellow, Nija Limaye. Her project is named Nuestras Historias, or Our Stories, and the educational content that she developed is in the tablets that are displayed along the Amazon. So we started Mamás del Río in 84 communities, along 3 major rivers in 350 kilometers of river extension in the Amazon. And then, thanks to the excellent project reception, the Ministries of External Affairs of Peru and Colombia approved its implementation in the third binational cabinet. So this is how Mamás de la Frontera, or Mothers of the Border, was born. And now we are operated in communities along both sides of the Putumayo River in Peru and Colombia. We just got a new grant that will allow us and will allow the community health workers to not only care for the health of mothers and newborns, but will also promote family planning and will identify cases of violence against women. In Mamás del Río, we have developed an evaluation of the program that we just submitted to the Lancet that shows that our program improves almost all essential newborn care outcomes around thermal care, breastfeeding, and cord care. And we were also able to increase institutional delivery by 10%. Now, we have also identified that there is one important problem, adolescent pregnancy, because we have had pregnant women of 11 and 12 years old. So this is why Lisa Woodson, a current Fogarty Fellow that is now in the field, is doing a study on the prevention of adolescent pregnancy in these settings. Now we know we're not going to get sustainability through grants. We know that. So that is why we're working with a top-down and a bottom-down approach. So in the top-down approach, we are working with the Ministry of Health, with the regional government of Loreto and the municipalities to make Mamás del Río part of a public policy in Peru. And in the bottom-up approach, we're working on community empowerment. And I want to highlight here the work of Tina Samsanchariat, last year Fogarty Fellow, who conducted this beautiful work called Escuchen mi voz, or Listen to my voice, in which she trained community health workers and they, through photo voice and storytelling, and they were able to display in a gallery in the Ministry of Health and in the regional government of Loreto how vital was their work during the COVID pandemic. And I am happy to say that after her work, the community health workers formed the first indigenous association of community health workers in Loreto, and we are super proud of them. We have also generated evidence along the development, implementation, and evaluation of the program with the hope that we can influence policy. Now, what was the difference between AIMBO and Mamás del Río? That in AIMBO, I started with a research question about what wasn't known in the literature about this virus. Whereas in Mamás del Río, I started addressing the needs of the community, the needs that I experienced myself by being pregnant in the Amazon, and also the needs that the community told me along all my years of work in the field. So in Mamás del Río, we work in close collaboration with the communities. We have developed materials together with the community. We share leadership with the community with the aim of inserting community health workers as in the public policy in Peru, and we are fighting together for the rights. In other words, we are trying to influence policy. In Mamás del Río, we're doing something that is called social innovation in health. I want to end by saying that what drives your research question is essential. And it's also vital to think what will happen when your intervention ends. What will be the implications of your findings? Are you generating research to influence policy? Because as you know, the work of a researcher doesn't end when we publish the paper, but when we make a significant impact in the lives of the communities we serve. Thank you very much for your attention.